1 year is not a lot of time. You're considering changing the whole health care for the whole country.
We're not considering changing the health care. First of all, we're not considering changing the whole health care for the whole country. If you like what you have, you can keep it, and I think most people will. 80% of people have insurance. Of those 80% think that their insurance is pretty good. Those people aren't going to be changing anytime soon. Second of all, I would disagree with your numbers. Veterans Administration has the highest percentage of people satisfied with any program. Most people think it's the best run program in the country. It is true that Medicare, most people, I've seen people at these meetings get up and say, don't let the government fool with my Medicare, because they love their Medicare. Now, the government happens to run Medicare. So I would disagree. I think we're ready, as long as we don't try to stick everybody in the public option all at once, I think we're ready. I think, the CBO has estimated the Congressional Budget Office, which is probably the most, even though everybody gets mad at them when they don't do something they don't agree with, but I think it's the one I always look to. It's the most nonpartisan. No matter who's running Congress, they always say what they think, whether we like it or not. They estimate about 10 million people will sign up for the public option. That's a drop in the bucket compared to the 50 million we already have in Medicare. I think we're ready. I think we do it. I think we better do it now, because if we don't, we'll lose the opportunity, and then we will lose more jobs. Thanks very much.
So right now in Washington, D.C., at switchboards in the city office buildings and the House office buildings, there are staff counting phone calls. And if no this issue, I understand that this choice is going to be made next month. I would put it to you that it makes sense to call Senator Brown. It makes sense to call Senator Voinovich. It makes sense to call your member of Congress. I would agree with Governor Dean. In our union, we believe not only is America ready, but that we can't wait. So I would ask you to say three things. If you call your member of Congress, you call your senator. Everyone ought to have access to health care. Everyone ought to have access. An insurance company shouldn't be able to limit people based on their...
For anybody who's got to get out of here, there is a back door. If anybody'd like to take off out the back.
Now's our chance, as citizens of this country, as working people, to make our voice heard.
And I'd like to discuss Section 102 of the American Affordable Health Care Act. Section 102 is the section that claims to protect the choice to keep current coverage, and technically it does, but you've got to look into it a little further to see what's really going to happen. The first part just defines grandfathered health insurance coverage, and it basically says that your plan is grandfathered into the new system that's created under this bill, and that you would be able to keep it. However, the first section, Section 1, limitation on new enrollment, tells a slightly different story. It says, except as provided in this paragraph, the individual health insurance insurer offering such coverage does not enroll any individual in such coverage if the first effective date of coverage is on or after the first day of year 1, which essentially means that this health coverage that you've got, no new people can be enrolled into it. So what happens as time goes on, people change jobs, people retire, people get fired. These people get dropped off the rolls. They're no longer paying into the private plan. So eventually you reach a point where there's not enough people enrolled in this plan to keep it solvent. And another problem, that creates one of two problems. Either the rates will increase such that the plan becomes unaffordable to the average American, or you have what happens in this bill, which in a few sections down, restrictions on premium increases. The insurer cannot vary the percentage increase in the premium for a risk group of enrollees in specific grandfathered health insurance coverage without changing the premium for all enrollees in the same risk group at the same rate as specified by the commissioner. So effectively right here you have the insurer being told that they cannot vary their rates without the blessing or consent of the commissioner, which is a position that it will be appointed by the president according to this bill. So effectively you have 80% of those, as Howard Dean said at the meeting today, that are using private insurance that they're happy with, that will ultimately end up having to give up this coverage because the private insurers offering it will not be able to continue offering that plan once the number of enrollees drops to a level that makes the plan insolvent. So this bill will sort of tie into what President Obama said before he was president, that he would see a single payer system enacted within about 10 to 12 years. As this bill states here, everybody will ultimately be forced into the insurance exchange, which is under which every plan, all the details of every policy are dictated by the government. The price is dictated, the coverage is dictated, all the policies are dictated by the government, even if it's a so-called private option. And then you have the issue that these so-called private options are going to have to play by rules and under prices set up by the government, which is the owner of the public option. So the public option is going to be getting taxpayer monies, at least in the initial 10-year outlay. There's a lot of public tax dollars being used to subsidize the public option, which will at least initially make it a lot cheaper than the free market private options. If effectively, once whatever limitations there are on initial enrollments into the public option, once those expire, you're basically looking at the government becoming the main player in the health insurance industry because of the tax subsidized public option, and because they are the ones that will be writing the rules for the game which they will be playing in, and that is the insurance industry.